Hi and welcome back to The Health Perspective. Do you get anxious about your health? There's no denying that anxiety around health has increased ever since COVID-19. Therefore, it's a topic that I want to discuss so that you can feel better suited to managing it yourself or know when you may need to seek professional help. Today, I'm going to talk through why health anxiety can be so difficult for those who suffer from it and the signs and symptoms of health anxiety in day-to-day life. I'm your host, Dr. Daniel Gordon, and I'm an experienced GP, having these kinds of conversations in my clinic on a day-to-day basis to help my patients. This podcast is part of my attempt to bring these conversations out to help a wider audience. So, in my clinical practice, I've noticed that health anxiety has become significantly more common in recent years, probably since the COVID-19 pandemic. And that makes sense when you think about all of the fear and uncertainty we were exposed to at that time. Before diving into the specifics of health anxiety, let's take a moment to remind ourselves about anxiety in general. And the key point here is that anxiety is not a bad thing. It's a natural emotion. We evolved to feel anxiety because it keeps us alert in certain situations to potential dangers, pushing us to plan ahead, stay vigilant, or steer clear of risky environments. For example, if you feel anxious before a critical exam, the anxiety can sharpen your focus and help you perform better on the day. Anxiety, however, becomes more problematic when it's disproportionate to the actual risk or when it shows up so frequently and intensely that it disrupts day-to-day life. Now, health anxiety at its core, and I'm obviously oversimplifying here, is a preoccupation with having or getting a serious illness. A person with health anxiety may spend a significant portion of their day in anxious worry, catastrophizing about serious conditions like cancers, heart disease, autoimmune conditions, or infections. In response to these worries, they often might repeatedly visit doctors, accident and emergency departments, or hospitals. They can also spend a lot of time researching symptoms online, which is a significant problem in this day and age when healthcare information is freely available online, but is not always of appropriately high quality. If you're looking at information online and you're in an anxious mood, you're more likely to find alarming information or worst case scenarios, which further reinforce your anxiety. And what makes health anxiety so problematic for some people, so nefarious, is how physical sensations can drive further anxiety. So when you're anxious, your body often produces real physical symptoms, such as a fast heart rate, muscle tension, sweating, chest pain, or tremors. But if you are already primed to look for signs of illness, these stress-induced physical symptoms feel like more evidence that you have a physical health problem going on. And it creates a vicious cycle which can be so hard to break. Now, the question is, when does normal anxiety about our health spill into clinical health anxiety? And the key factors that I would look for, or key indicators when I'm speaking to a patient, is the following. Firstly, excessive worry about having or developing a debilitating or life-threatening illness. Secondly, frequently undertaking behavior aimed at checking your health, for example, checking your body for abnormalities. Third, continually seeking reassurance from doctors, friends, or family, and that reassurance not lasting a long time necessarily. Fourth, spending excessive time or mental energy researching illnesses. And finally, becoming highly distressed by minor or normal bodily changes. If these problems and symptoms last for at least 6 months and cause significant distress or impairment in your daily functioning, that is, your ability to go about your normal activities like looking after your family or going to work, it could indicate a diagnosis of health anxiety. And there might be 2 types of ways that people with health anxiety approach doctors. They may be the type who seek medical care actively. So, go to the doctor frequently for reassurance, tests, procedures to try and reassure themselves that nothing serious is going on. But on the other side, they might be the kind of person who avoids seeing their doctor entirely, either because they're scared of wasting their doctor's time, or because their fear of a serious illness is so high that they actually fear confirmation of a bad diagnosis. And here's one super important thing to remember. Not everyone who is highly concerned about specific health conditions has health anxiety. For example, if you've had a close family member pass away from a certain illness, or you have a specific genetic risk of a certain illness, you might understandably be vigilant or worried about your own risk. In health anxiety, however, your level of worry tends to be disproportionate to the level of risk and persists even when there is little or no evidence of an actual problem. And the reason it's important for you to know if you may have a diagnosis of health anxiety is because managing health anxiety can be a little different from managing other types of anxiety. And this is why, if you have symptoms of health anxiety, it's vital that you seek appropriate support from a trusted healthcare professional. People with health anxiety benefit a lot from continuity of care. So a doctor, healthcare professional, or psychologist who sees them on a regular basis and gets to know them over time. It's extremely important that they have someone who understands their health-seeking behavior and can help reassure them in a balanced way without reinforcing their need for validation about their physical symptoms, but also without making them feel dismissed or judged. If you have been affected by this video and think you may be struggling with health anxiety, make sure you reach out for professional help. I've also included some helpful links in the bio below specifically for you. I really enjoy answering your queries and discussing the topics that matter to you at home, as well as my patients who I look after in clinic. So please do drop me a comment below on what you'd like me to discuss next, and upvote other people's comments so we can see which are the most popular topics to cover. Next week, I'll be discussing cow's milk allergy in babies, specifically aimed at helping new parents. I look forward to seeing you then. Until next time, bye.